You're tuning into The Deep Dive.
hmm
Today, we're getting into a topic that probably pops up if you're curious about healthcare, specifically health information.
Yeah, maybe you've wondered what it really means or who does what behind the scenes.
Exactly. Or maybe even if it's a career path for you. We've looked at info from places like AHIMA, some career sites, academic stuff too.
hmm To try and give you a solid handle on it.
So our plan is to break down what health information actually is, and then look at these two big areas, health information management or HIM.
In health informatics, HI. They sound alike, but they're pretty different.
Right. So we want to clear that up, talk about jobs and, what the future looks like in these fields. They seem to be growing fast.
Definitely growing.
Okay, so let's start right at the beginning. What is health information? It sounds, well, broad.
It is, yeah. But fundamentally, health information is any data related to a person's health. Think of it like their complete medical story.
Okay.
So that's everything from, the first symptoms they have, the diagnoses they get,
Okay.
procedures, treatments, and what happens in the end, the outcomes.
So like history, lab results, x-rays.
Exactly. All of that.
Yeah.
Plus clinical details, demographic info, and importantly, the notes doctors and nurses write.
Gotcha. So it's not just one appointment, it's the whole timeline.
Precisely. And AHIBA points out there are really two ways to look at it. You track one person's health over time, see the changes,
Okay.
but also when you pool together information from lots of people, you start seeing bigger patterns, population health trends.
Ah, right. Like how common a disease is in a certain area or age group.
Exactly.
Yeah.
Super valuable for public health.
And
You can also see how well different treatments are working on a larger scale.
that makes total sense. The individual story and the big picture. I saw this AHIMA quote that stuck with me. Health information is human information. Health information is the patient's story.
Yeah, that really hits home, doesn't it?
It does. It reminds you there's a person behind all that data.
Absolutely. And it underscores the responsibility. It's not just numbers, it's someone's life.
Yeah.
How we manage it matters.
So the HIM professionals, they see that connection.
They really do. They have this unique viewpoint. They see the whole narrative in the data. Their job is making sure the human story is accurate, accessible for care, but also kept private and secure.
Okay, that's a good lead-in. We understand health information now. Let's tackle health information management, HIM. What's the core idea there?
So HIM, it's the actual practice of getting, analyzing, and protecting medical info, both digital and, well, sometimes still paper.
Protecting is key, sounds like.
Vital. It's all about supporting quality patient care. And it's an interesting mix, like you said earlier. It involves business, science, and IT.
Business, science, IT, quite the blend. What does an HIM professional actually do?
Well, they're highly trained. They know information management tech. They understand how healthcare works, hospitals, clinics, you name it. They're essential for the day-to-day running of health info systems, especially electronic health records, EHRs.
Right. EHRs are everywhere now.
Exactly. And the HIM pro's job is to make sure that info is complete, accurate, and again, protected. They're guardians of that human information.
Guardians, I like that. You mentioned they're like a bridge.
Yeah, a really crucial bridge. They connect the doctors and nurses creating the data
Okay.
with the administrators using it, the tech people designing the systems, operations, IT folks. They help everyone speak the same language, basically.
Wow, that's a lot of coordination.
It is. And a big part of that is using standardized ways to classify diseases and treatments.
Ah, I read about that. Why is classification so important?
Oh, it's fundamental. It standardizes the data.
Hmm.
Think about research you need to compare apples to apples, right?
Yeah, it makes sense.
It's also critical for billing, making sure providers get paid correctly.
Hmm.
And for legal stuff, compliance. It's like a universal code book for medicine.
It's kind of amazing how long people have been keeping records. I saw something about ancient Mesopotamia.
Yeah, it's fascinating. The earliest records we know of, clay tablets, then Egyptian scribes on papyrus. Even ancient Greeks and Romans kept detailed patient histories. So the need to record this stuff is ancient. The tech is new, but the idea isn't.
And modern HIM grew out of that need for organization, leading to AHIMA.
Exactly. People like Grace Whiting Myers saw the need for structured records.
So HIM managing and protecting patient info for quality care. Got it. Now let's switch gears to health informatics, HI. How's that different?
Okay, so HI, it's related but distinct. It's more the science of how we use data, information, and knowledge to improve health and healthcare delivery.
The science behind it?
Kind of. Think of it as a part of the broader field of informatics, but focus specifically on health. HI deals with the technologies and systems that, well, that make him possible.
Ah, okay. So HIM uses the tools that HI helps create.
That's a good way to look at it.
Yeah.
HI figures out how to go from raw data, like, say, a bunch of blood pressure readings, to useful information, like spotting a pattern of high blood pressure,
Right.
and then to actionable knowledge, like deciding the best treatment based on evidence.
Nice.
Data, information, knowledge. Okay.
Yeah. And another definition from HIMSS talks about integrating healthcare science, computer science, information science, even cognitive science, all to manage healthcare info better.
So it pulls from a lot of different fields.
Oh.
Does HI have a history too?
It does, though maybe more recent in its formal sense. Again, people recorded health info way back, but the computer age was the real catalyst.
Right, computers changed everything.
Definitely. In the late 60s, early 70s, people started seriously thinking about applying computers to healthcare. That led to organizations like AMIA, the American Medical Informatics Association.
Interesting. So HIM and HI sort of grew up alongside modern computing.
Yeah.
Okay, let's talk jobs. What kind of roles are there in HIM?
Okay, HIM roles. You've got the health information manager. They're often leaders, overseeing record security, managing teams, making sure everything's compliant, auditing data.
Compliance must be huge in healthcare. Oh, absolutely. Then you have medical coders. Often these folks have an RHIT certification. They review patient charts and assign those standard codes for diagnoses or procedures.
The codes for billing and stats.
Exactly. Super important for billing, but also for tracking diseases, research, statistics. They're kind of translators between the clinical side and the admin billing side.
Okay, translators. What else?
Well, within HIM, you also have data analysts. They dig into the medical data to find insights, maybe ways to improve care or see how effective treatments are.
So more focused on analysis within the management context.
Right. Then outpatient coding compliance auditors, they double-check the coding and billing to catch errors. Very important for accuracy and finances.
Makes sense.
And clinical documentation specialists. They manage records for things like clinical trials, making sure everything is accurate and complete among the medical staff.
And you mentioned certifications, RHIA and RHIT.
Yeah, generally, the RHIA administrator is often geared towards more leadership roles, while the RHIT technician might be in more technical or specialized coding roles. But there's overlap, of course.
Okay, quite a range in HIM. What about HI, health informatics? What jobs do you see there?
In HI, you'll often see titles like Health Informatics Specialist. These are the people really involved in designing, building, implementing, maintaining those healthcare IT systems.
So more on the tech development and maintenance side?
Generally, yeah. You also have health data analysts in HI, but they might have a more technical, programming-heavy focus, using specialized software, maybe statistical programming languages, to analyze really large data sets.
Digging deep into big data for health insights.
Exactly. Then clinical systems managers, they focus on keeping the specific computer systems used in hospitals or clinics running smoothly, updated, meeting the user's needs. Needs both IT skills and healthcare knowledge.
Right, you need to understand the clinical workflow.
Definitely. And you also see HI roles emerging in areas like telehealth, building clinical decision support tools for doctors, even computer-aided diagnosis systems. It's very tech-focused problem solving.
Sounds like really interesting cutting-edge stuff in HI. Both fields seem pretty vital. So the big question, what's the job outlook? Are these good fields to get into?
Yeah, the outlook is generally really positive for both. AHIMA pointed to BLS data showing medical records and health info techs as one of the faster-growing jobs, projecting, I think it was 11% growth from 2018 to 2028.
That's pretty solid growth.
And some other predictions around that time were even higher, maybe closer to 18% growth for HIM jobs.
Wow. Okay, what about salaries in HIM?
Well, the median back in May 2018 for the technicians was around $40,350. But that's often an entry point.
Right, it goes up with experience and credentials.
Exactly. Move into administration, get certified like RHIA, and it climbs. Healthcare administrators, many with HIM backgrounds, had a median around $101,000 in 2019, with similar strong job growth expected. Other data suggested HIM salaries could range from, say, the low 80s up past $107,000, with a median maybe in the high 90s, though that data was from 2017, averaging across common HIM jobs maybe something like $65,000 a year.
So decent potential. What about HI salaries and job market?
The BLS doesn't have one neat category for health informatics,
Yeah.
But the IT jobs common in HI are generally in demand.
Okay.
And if you just search job sites now for health informatics or healthcare data analyst, you see a lot of postings.
High demand.
Seems like it. Salary-wise, data from 2017 suggested HI pros like computer systems or network experts in healthcare might range from $70,000 to maybe $88,000, with a median around $81,000.
So also strong potential there. Where are these jobs typically found?
Across the board, really, hospitals, clinics, doctors' offices, sure, but also academic institutions doing research, consulting firms, government agencies like public health departments, and definitely healthcare software companies.
Lots of options. And demand seems likely to stay strong.
Yeah, with changing regulations, new technology always coming out, and just the general growth in healthcare, experts in managing and analyzing health data are likely to be needed for the foreseeable future.
Makes sense. It definitely sounds like HIM and HI are solid fields. If someone is interested, how do they prepare? What's the education like?
For him, the education is pretty versatile. Programs blend clinical knowledge, IT, leadership, management skills. You'll study medicine basics, management, finance, IT, law.
Covers a lot of ground.
It does. And you can find programs at different levels, associates, bachelor's, master's, even certificates. A key thing is to look for programs accredited by KKM,
TAIM.
Commission on Accreditation for Health Informatics and Information Management Education, sort of the quality standard.
Good tip. What about for HI?
HI programs are often at the graduate level, master's or PhDs. You usually need a bachelor's first, often in something like computer science, info science, maybe biology, or another health field.
So often a master's for HI. Are there resources to explore careers?
Yeah, HEMA has things like a career map and career assist on their website.
Yeah.
Really helpful for seeing the different roles and planning a path, especially in HIM.
Great resources.
Yeah.
Okay, this has been super helpful in sorting out HIM and HI. Let's just quickly recap.
Sounds good.
So health information, that's the core patient data, the story. HIM, health information management, is about managing and protecting that story, accuracy, security, access.
Right. Guardians.
And HI, health informatics, is more about the science and tech and the systems, the tools, the analysis that make managing the information possible and improve healthcare.
Exactly. Building the tools and using them for deeper insights.
And both are growing fields, vital to healthcare with different but sometimes related job roles and a positive outlook.
Absolutely. And as we rely more and more on data and tech in medicine, these fields are only going to become more central, I think.
Definitely food for thought. How will data continue to change healthcare and what new roles might pop up in HIM and HI? Something to think about. If this deep dive caught your interest, definitely check out resources from a HEMA or an EMI or look into programs near you.
Good advice.
Thanks so much for breaking this all down today. And thanks to all of you for listening to The Deep Dive. We'll catch you next time.